This thing is over 200 years old, and yet doctors are still using it? Why is that? We've got AI, we've got smartwatches, we've got scanners, and yet it's still a staple of today's doctors. Let's talk about it. The stethoscope was invented in 1816 by René Lennox. Before then, doctors would listen to someone's heart by literally putting their ear to their chest. Lennox found that pretty awkward, particularly with young women, so he thought, let's roll up a piece of paper, put that to someone's chest, and have a listen that way. And boom, a stethoscope was invented. And for 200 years, it's been a symbol of medicine. A stethoscope lets a doctor listen to your body, be it your heart, your lungs, your bowels, or even your vessels. So when a doctor listens to your heart, they're checking for a normal rhythm and checking for things like any murmurs, which might indicate a problem with valves or blood flow. A normal heart sound should have absolutely no added sounds to it. It should just be 2 quick beats with no rumbling quality to it. When they're listening to your lungs, they're checking for any breath sounds. They're checking if there's any abnormal sounds to it, so be it wheezes, which might indicate things like asthma, or things like crackles, which are these popping sounds that might indicate infections or fluid overload. Or alternatively, there might be no sound at all, which might indicate a collapsed lung that might need drainage. But it's kind of wild that something like this hasn't been replaced yet. There are 3 main reasons for it. Firstly, it's portable. It's very lightweight. You can put it on your shoulders, doesn't need any batteries, doesn't need software updates. You can use it anywhere you want, be it in clinics, in hospitals, and even disaster zones. So secondly, it's quick. It doesn't need any booting up. Within seconds, you can put it on someone's chest and have a listen to their heart, their lungs, and get an idea of how well they're doing. Thirdly, it's a matter of trust. For patients, it's familiar. For doctors, it's a skill that they learn. There's a subtle art to pick up different heart sounds, different lung sounds to reach a diagnosis and piecing them all together. And also, it helps build a connection when you're examining a patient that a machine can't replace. But isn't tech just better? Now, there is truth to it. So things like MRI scans, CT scans, ultrasound scans, they can give you a ton more information. But that comes at a cost. Some of that cost is literal, which is it just costs more money to do. But also, you've got the time cost in terms of arranging equipment, getting them into the right scanner, getting the scans reported by professionals who just report these kinds of scans. But also, you can't do these things in an emergency. If someone's unwell with a cardiac arrest, for example, you can't take them away from that treatment environment to have a scan. But actually, a stethoscope can be used in any environment, and so it's a lot more practical. So the stethoscope is low-tech, and that's kind of the point. It just works. Now, don't get me wrong, smart stethoscopes do exist. Some of them use AI to analyze sounds automatically, some of them have volume dials, some of them can record the sounds for later reference. But they're more expensive, they require recharging, they require software updates, and it kind of defeats the purpose of having ye-old stethoscope that's always there for you. So in a world of cutting-edge tech, the classic stethoscope is still very much with us. And that's not because it's perfect, but because it's simple, fast, and human. Sometimes the best tech is the one that never needs an update. Thanks for watching, and follow for more things about the human body.